Hey there everyone! Today we're diving into a critical topic that affects women's health, the warning signs of stroke. Strokes are a leading cause of disability and death worldwide, but they don't discriminate. They can happen to anyone, anywhere, at any time. The key to preventing the severe consequences of a stroke lies in early recognition and immediate action. But here's something you might not know. While men and women share many of the same stroke symptoms, women can experience unique signs that are often overlooked. This makes it even more crucial for women, and those who care about them, to be aware of these less-known symptoms. Over the next few minutes, we'll explore 7 warning signs of stroke in women. By the end of this video, you'll be better equipped to recognize the signs and, if necessary, take swift action. Strokes can happen to anyone, but did you know that women may experience different symptoms than men? First on our list is sudden numbness or weakness, especially on one side of the body. It's like an unexpected wave of lethargy washing over you, rendering one side of your body weaker than the other. This could reveal itself in a few ways. Perhaps there's a noticeable droop on one side of your face, a sagging smile, or even a single drooping eyelid. Or maybe you find that one of your arms or legs seems a bit harder to control, feeling strangely heavy or unresponsive. And then there's the speech. You might experience an unusual struggle with your words, either understanding them or getting them out. It's as if your brain and your mouth are suddenly speaking different languages. These are all potential harbingers of a stroke, and they demand immediate attention. So if you or someone you know experiences sudden weakness or numbness, especially on one side of the body, it's crucial to seek medical attention immediately. Next, pay attention to sudden confusion or trouble speaking or understanding. This is the second warning sign we're discussing today. During a stroke, women may experience speech difficulties which could range from forming coherent sentences to slurred speech. This results from the disruption of blood flow to the brain, affecting areas responsible for language and comprehension. It's like trying to have a conversation while underwater, where words just seem to float away or get muddled. Another alarming sign is sudden confusion. This could mean difficulty understanding what others are saying, or even a sudden inability to perform simple tasks. Imagine being in the middle of a daily routine when suddenly, it feels like you're reading instructions in a foreign language. It's disorienting and frightening. If you notice sudden changes in speech or confusion, it's essential to act fast. Time is of the essence when dealing with a potential stroke. The quicker the response, the better the outcome can be. The third warning sign is sudden trouble seeing in one or both eyes. Now this may seem alarming, and rightly so. When it comes to strokes, our vision can give us vital clues. You might experience blurred vision, almost like looking through a foggy window. Or you could be seeing double, where everything appears in pairs. In some cases, there could even be a sudden loss of vision in one eye, almost like a curtain has been drawn over it. These symptoms can occur suddenly and can be quite frightening. But remember, the key here is to act fast. Don't brush these symptoms off as just a sign of tiredness or a common eye problem. If you experience sudden changes in your vision, it's a sign that something serious might be happening. Don't wait around hoping it will pass. If you experience sudden vision changes, don't wait, seek medical help right away. Another warning sign is a sudden severe headache with no known cause. Now we're not talking about your typical tension headache or a migraine that you might be familiar with. This is a headache that hits you out of the blue, like a bolt from the sky, and it's often described as the worst headache of your life. This headache may come on suddenly and be so intense that it's hard to focus on anything else. It might feel like a sharp, piercing pain, or it could be a throbbing ache that engulfs your entire head. It's not linked to any apparent triggers like stress or dehydration, and it doesn't respond to over-the-counter pain relievers. But what makes this headache a potential warning sign of a stroke isn't just its severity, it's also the company it keeps. This sudden severe headache may be accompanied by other symptoms, such as a sudden weakness or numbness, especially on one side of the body. You might find it difficult to lift an arm or leg, or your speech might become slurred or hard to understand. You might also experience visual disturbances like blurred or double vision, or even a complete loss of sight in one eye. Other accompanying symptoms could include dizziness, a loss of balance or coordination, or even sudden nausea or vomiting. These symptoms can be frightening, and it's crucial not to ignore them. If you experience a sudden, severe headache, especially if it's accompanied by these other symptoms, it's vital to take it seriously. Don't try to tough it out or wait for it to pass. Instead, seek medical attention promptly. Call for emergency help right away. Remember, when it comes to a potential stroke, time is of the essence. The sooner you get medical help, the better your chances of minimizing damage and improving your outcome. So to recap, a sudden severe headache with no known cause could be a warning sign of a stroke, especially if it's accompanied by symptoms like weakness, numbness, difficulty speaking, visual disturbances, or sudden nausea or vomiting. If you experience a sudden severe headache, it's important to take it seriously and seek medical attention promptly. Pay attention to sudden trouble walking, dizziness, or loss of balance or coordination. This is the fifth warning sign of a stroke, and it's a critical one to recognize. When a stroke occurs, it can disrupt the brain's ability to control our body's movement and balance. This may result in a sudden onset of unsteadiness or an inability to walk straight. You might feel like the world is spinning around you, or you could have a sensation of being pulled in one direction. Indeed, trouble with balance and coordination can be quite frightening as it disrupts our fundamental ability to navigate through our daily lives. It's important to understand that these symptoms can appear suddenly, without any warning. So, if you or someone you know is suddenly having difficulty walking, or experiences dizziness or a loss of balance, it's crucial to act without delay. Remember, time is of the essence when dealing with a possible stroke. If you or someone you know experiences sudden dizziness or loss of balance, don't delay, seek medical help right away. And finally, be aware of sudden nausea, vomiting, or general malaise. These symptoms can be quite unsettling, and they might seem like they're signaling a common stomach bug or flu. However, in the context of a stroke, these symptoms aren't so benign. They can appear suddenly, often in combination with some of the other signs we've discussed. What's crucial here is the sudden onset. If you're feeling perfectly fine one moment, and then abruptly you're hit with a wave of nausea, vomiting, or a sense of general unease, it might be more than just a stomach bug. And remember, these symptoms don't exist in isolation. They often occur in conjunction with other symptoms such as sudden numbness, confusion, or trouble seeing. So, if you experience sudden nausea or vomiting, especially along with other stroke symptoms, don't brush them off. If you experience sudden nausea or vomiting, especially in conjunction with other symptoms, it's important to seek medical attention promptly. Thank you for tuning in to today's video. We've unpacked a vital subject that affects women's health, the warning signs of stroke. Let's quickly rehash these 7 signs, so they're fresh in your minds. First, we discussed sudden numbness or weakness, particularly on one side of the body. This could look like a sagging face, an arm or leg losing strength, or even trouble speaking or understanding others. Secondly, we highlighted sudden confusion or difficulties with speech. Women may struggle with forming words or have slurred speech during a stroke. Third, we talked about the sudden trouble with vision. This might appear as blurred vision, double vision, or even complete vision loss in one eye. Next, we explored the sudden severe headache with no known cause, often accompanied by other symptoms such as weakness, numbness, or speech difficulties. We then talked about sudden trouble walking, dizziness, or loss of balance or coordination. Difficulty with walking or maintaining balance during a stroke is a common experience for women. And lastly, we discussed sudden nausea, vomiting, or a general feeling of being unwell. While these symptoms can be caused by various factors, they may also signify a stroke, especially when combined with other symptoms. Recognizing these symptoms is crucial, as immediate action could save lives. As we've learned, strokes can happen to anyone, but women may experience different symptoms than men. By understanding and recognizing these signs, we can empower ourselves and those around us. So, let's spread the word. If you found this information helpful, share it with your friends, your family, and your community. Let's encourage everyone to prioritize their health and be vigilant about these signs. And remember, there's a wealth of knowledge waiting for you on our channel. We're committed to providing important health tips and information, so don't forget to like this video and subscribe to our channel. If you found this information helpful, please like and share this video, and subscribe to our channel for more important health tips. Take care and stay vigilant.